Today is the launch of a community-wide campaign that could save lives. The goal of FluVaxJax is to get as many people as possible vaccinated in an effort to reduce the number of patients who end up in the hospital with the flu. And you may have questions, too, about the flu shot, the COVID-19 vaccine, anything that will protect you from getting sick. Melanie Lawson is here right now with a panel of doctors who are answering your questions and addressing your concerns. And Melanie, people without insurance can request a flu shot for free.
That's right, Mary. So if you have insurance, keep in mind the flu vaccine is free. But if you do not, it can be expensive. A vaccine can cost anywhere from $35 to $55. And if you have a family of four, that is upwards of $200. But this year, you're covered. What a difference a year makes. Last year, at the start of flu season, we were desperately fighting COVID-19, a virus with no vaccine. It made doctors focus on what we could control.
So we wanted to make sure that people were vaccinated against the flu to keep them out of the hospital. And it worked really well last year. This year, it seems like it's even more critical for us to do that because our hospitals are near capacity just with COVID patients.
Head of the Duval County Medical Society Foundation, Dr. Sunil Joshi, has been tirelessly working to educate people about the facts. He's encouraged people to get vaccinated and do whatever it takes to protect others from getting sick.
I was born and raised here in Jacksonville. This community means everything to me. And to see the divide, the healthcare divide in our community, which I've seen since I started practicing here, become so much more prominent with this pandemic, makes me want to push to try to do things to equal the playing field a little bit.
This year, we have a vaccine for COVID-19, but Dr. Joshi points out there are more people in the hospital with coronavirus complications than in 2020.
The COVID hospitalizations this year compared to last year are significantly higher.
FluVaxJax is focused on eliminating flu hospitalizations with a vaccine that is 80% effective in keeping children out of the ICU. And 70% effective in keeping seniors out of the hospital.
When you put interventions into place and nothing bad happens as a result of that, then it's very easy to say, well, who knows if it would have worked if you didn't do it. But the bottom line is, why should we take a chance? Why should we wait and see what happens?
It could be a deadly regret.